You've lived a full, honorable life. You built a career, raised a family, and carried responsibilities that shaped generations. But no one warned you about this. That one day, in your 60s or 70s, after everything you've endured, you might suddenly feel powerless in the most private part of your life. That you might climax too soon, sometimes even before true intimacy begins. It can feel like a betrayal of your body, your confidence, even your identity as a man. And perhaps the hardest part? No one talks about it. But I do. I'm Dr. James Ellison, a men's health specialist and professor of urology with over 30 years of experience helping men navigate exactly these kinds of challenges. And if you're dealing with premature ejaculation later in life, I want you to know two important truths. First, you're not alone. This is far more common than you've been led to believe. Second, there are real, effective solutions. Many assume this issue is only for younger, inexperienced men, or that it's just a lack of control or technique. But the reality is more complex and more hopeful than that. But what if I told you the truth is more complicated and much more hopeful? What if I told you that many older men suffer from it, not because they're doing something wrong, but because of changes in the body they've never been told about in today's episode? I'll explain why premature ejaculation often appears or worsens with age, the biological and emotional forces driving it, and most importantly, what you can do starting today to take back control. I'll also reveal the one mistake most men make that actually makes it worse. So don't go anywhere. What you're about to hear might just change the most intimate part of your life for the better. Before we get started, if you haven't
already, I encourage you to subscribe and turn on notifications so you never miss another episode focused on real solutions for men's health at your stage of life. And if this topic speaks to you, type 1 in the comments. If it doesn't, type 0. Your feedback helps me create better, more meaningful content for you. All right, let's begin by understanding exactly what we're talking about. Because premature ejaculation isn't just a vague frustration or a one-time issue. It has a clear medical definition and knowing.
That is the first step toward taking back control. So what is premature ejaculation really? Let's break it down. 1. What is premature ejaculation? PE, when a man reaches his 60s or 70s, there are a lot of changes he comes to expect. Slower mornings, grayer hair, maybe a few new pills on the nightstand. But one thing no one ever seems to prepare you for is what happens when your body starts rushing you through something that once felt natural, controlled, even sacred. You find yourself finishing too soon, and not just occasionally, but often before you're ready, before your partner is ready, before the moment has even had a chance to mean something. That's premature ejaculation. And I've had hundreds of older men sit across from me, eyes filled with frustration, asking the same quiet question. Why now? Some thought it only happened to young men, the ones still learning. Others assumed it was just part of aging and something to silently accept, but neither is true. Medically speaking, premature ejaculation, or PE, is defined as ejaculation that occurs within 1 to 2 minutes of vaginal penetration and happens more often than not. But this isn't about a stopwatch, it's about control or the sudden, confusing loss of it. It's about how it feels when your body does something you didn't tell it to do. And for many men, especially those in long-term relationships, it's about the guilt of leaving your partner unsatisfied, or the anxiety of wondering if it will happen again. What's even more surprising is just how common it is. Nearly 30% of men experience PE at some point in their lives, yet fewer than 10% ever speak to a doctor about it. Most suffer in silence, feeling embarrassed or ashamed, not realizing that what they're going through has a name and a solution. There are actually 2 main types of PE. The first is called primary premature ejaculation. This is something you've had since your very first sexual experiences. ejaculating very quickly, often before penetration, and struggling with it consistently throughout life. In these cases, the issue is often related to the nervous system or genetics. It's simply how the body is wired, and it usually begins in adolescence or early adulthood. The second type is what I see more often in older men: secondary premature ejaculation. This happens after years of normal sexual performance. You may have had no issues in your 30s, 40s, or even early 50s, but somewhere along the way, things began to change. Maybe you noticed it after an illness or after starting a new medication. Maybe it came after a stressful period in life or after developing mild erectile dysfunction. Whatever the trigger, your body began creating a new pattern, one you never asked for and one that feels impossible to stop. And here's the difficult part. The more often it happens, the more anxious you become, and the more anxious you become, the more likely it is to happen again. It becomes a cycle, a loop of doubt and frustration, one that too many men quietly endure without ever being told that it's common, it's natural, and most importantly, it's treatable. I understand how deeply personal this can feel. For many men, sex isn't just physical, it's emotional. It's how they express love, confidence, connection. When something starts interfering with that, it can shake your sense of self. But let me assure you, this is not the end. It's a signal, a sign that your body is asking for something: understanding, attention, support, and that support exists. So now that we've made it clear what premature ejaculation is and that it's not something you imagined or overreacted to, it's time to ask the deeper question: why does it happen in the first place? Because once you understand the causes behind it, you'll see just how many ways there are to take back control. And some of them may surprise you. If you're still here and this conversation is resonating with you, type the number 1 in the comments to let me know you're walking this journey with me. Now let's continue, because what comes next may help you understand yourself in a whole new way. 2. What causes premature ejaculation in older men? Every time a patient asks me, "Why is this happening now?" there's a pause. Not because I don't know the answer, but because I know what they're really asking. They're asking why their body, after decades of knowing what to do, is suddenly working against them. They're asking why something that used to feel effortless has become a source of stress, shame, or silence. And they're asking why, and no one told them this could happen at their age. The truth is, premature ejaculation is not just a random event or a sign of weakness. It's the result of multiple layers: biological, psychological, emotional, all working together, sometimes against you. And for older men, those layers often become more pronounced with age. Let's start with the most obvious but least talked about piece: anxiety. Yes, men in their 60s, 70s, and beyond can still feel performance anxiety. In fact, many feel it more intensely than they did when they were younger. You're older. Now maybe you've had health issues, or maybe your erections aren't as strong as they used to be. You might feel pressure to keep up or prove that you've still got it. And when those doubts creep in, your body listens. The nervous system becomes hypersensitive and the arousal curve speeds up before you even realize it. The moment is over. Anxiety is powerful. It's not just in your mind. It sends real signals through your body. It activates the sympathetic nervous system, which is directly involved in triggering ejaculation. So when you're mentally tense, your body physically responds by making it harder to hold back. But anxiety isn't the only player. There are physiological changes happening too, real measurable shifts inside your body that no amount of willpower can overcome. One of the key culprits is serotonin. This brain chemical plays a major role in regulating mood and sexual function. When serotonin levels are low, it becomes more difficult to control ejaculation. Unfortunately, as we age, serotonin levels often decline naturally. Add in the fact that many older men take medications like antidepressants or blood pressure, drugs that also affect neurotransmitter balance, and you start to see how the brain's chemistry can change the way your body responds during sex. Hormonal shifts are another major contributor. Testosterone, the hormone most associated with male sexuality, gradually decreases with age. While most men focus on its connection to libido and erections, testosterone also plays a role in timing and sexual confidence. When levels dip, it can affect not just your desire, but your ability to stay in control. Similarly, imbalances in thyroid. Hormones can throw off your entire sexual rhythm without you even realizing it's the cause. Then there's sensitivity, specifically heightened sensitivity in the head of the penis. As men age, some develop a lower threshold for stimulation, meaning the physical sensations feel more intense more quickly. This increased sensitivity can lead to early ejaculation, even if your mind is trying to slow things down. Another piece of the puzzle is erectile dysfunction. This surprises many men, but it's something I see all the time. When a man starts having occasional trouble maintaining an erection, he may
begin to rush sex out of fear that he'll lose it. That sense of urgency quickly becomes a pattern. Sex becomes a race against the clock. Over time, the body adapts to this new pace and starts finishing faster, reinforcing the cycle of premature ejaculation. Lastly, we can't ignore genetics. Some men are simply more biologically predisposed to PE. If your father or brother experienced it, you might be more likely to as well. It's not something families usually talk about, but it's a factor worth recognizing. All of these causes, mental, chemical, hormonal, physical, don't make you less of a man. They make you human. And the beauty of understanding them is that it opens the door to solutions. Because once you know what's driving premature ejaculation, you're no longer helpless. You can address the root instead of just managing the symptoms. And now that we've uncovered what's happening behind the scenes, the next step is knowing how we determine if it's truly PE and not just a passing issue. In the next section, I'll show you the simple criteria doctors use to diagnose it and why recognizing the signs early can make all the difference. 3. How is premature ejaculation diagnosed? One of the most common misconceptions I hear from older men is the belief that if something doesn't show up on a blood test or a scan, it isn't real. That somehow, if they can't physically see it, maybe it's just in their head. Or worse, maybe it's not worth bringing up at all. I've had patients sit quietly in my office fidgeting, avoiding eye contact, unsure of whether they're even allowed to bring this up. And when they finally do, it usually comes out like a confession. "Doc, I think I'm finishing too fast." But here's what I tell them every single time. If it's bothering you, it matters. Full stop. Premature ejaculation is not about some rigid textbook definition or passing a medical test. It's about how your experience is affecting your life, your relationships, your confidence, your sense of intimacy. Diagnosing PE doesn't require invasive procedures or awkward exams. It begins with something much simpler and much more powerful. A conversation, a safe space, a willingness to be honest about what you're going through. That said, we do follow a set of well-established clinical criteria to help guide us. The first is timing. If you're ejaculating within 1 to 2 minutes of vaginal penetration on a consistent basis, meaning not just once or twice, but during most sexual encounters, that's the first sign. But we don't stop at the clock. The second and arguably more important factor is emotional distress. Does this bother you? Does it frustrate or embarrass you? Does it affect your partner? Has it started to create distance or tension in your intimate moments? That emotional weight is just as important as the physical timing. Some men last 3 or 4 minutes and still feel like it's not enough. Others might last only a minute but feel perfectly content. So for me, it's not just about duration, it's about dissatisfaction. The third piece is repetition. Is this something that happens almost every time you have sex? Is it becoming a pattern? You can't seem to break if the answer is yes. Then we're not talking about a one-time fluke or a bad day. We're talking about a real condition, one that deserves to be acknowledged and treated with the same care and seriousness as any other health concern. What's interesting is how many men think they need to prove something to be taken seriously. They'll say things like, "It's not every time," or "Maybe I'm just overthinking it." But here's what I remind them. You don't need to check every box perfectly to start a conversation. You don't need to minimize your experience. If it feels like a problem to you, then it is one, and that alone is enough to warrant support. I've also met men who come in thinking they have PE only to discover through our discussion that the issue may actually be something else, like erectile dysfunction, anxiety-related arousal issues, or a simple mismatch in sexual expectations. That's why diagnosis isn't just about ticking off symptoms. It's about understanding the full picture of who you are, what your relationship looks like, and how you feel about what's happening. And this is why I always encourage men to speak up early. The sooner we talk about it, the sooner we can identify whether it's truly PE, something else entirely, or a mix of factors. And from there we can build a plan that's tailored to your needs. Not just a general fix, but a personalized approach that respects your stage of life, your health, and your goals. So if you've been wondering whether what you're experiencing qualifies as premature ejaculation, I encourage you to stop second-guessing yourself. Trust what your body and emotions are telling you. That's the real starting point. Not a test result, but your truth. And now that we've clarified how PE is diagnosed, the next question becomes even more important. What can you actually do about it? Because while understanding the problem is essential, finding real practical ways to overcome it, that's where the transformation truly begins. And in the next section, we'll explore the most effective non-drug methods that are helping men just like you take back their control, starting from the inside out. If you're still watching, and these insights are striking a chord, type the number 1 in the comments to let me know you're here and engaged. Now let's move forward with point number 4. This next part could be a turning point for you 4. How to treat premature ejaculation without medication. I'll be honest with you. One of the most empowering moments I witness in my office is when a man realizes that not every solution has to come from a pill bottle, especially when it comes to premature ejaculation. For older men, there's often a quiet resignation, a belief that their only path forward lies in prescriptions or expensive treatments. But what I've seen again and again is that the body, even in its later years, still wants to work with you. It just needs the right kind of training and biased care. You see, our bodies are capable of incredible things even as they age. But like any machine that's been running for decades, sometimes it needs a little recalibration. And when it comes to PE, there are non-medical approaches that not only work, but often leave men feeling stronger, more aware, and more in control than they've felt in years. Let's start with movement. I've had men in their 60s tell me they'd given up on exercise, assuming it was too late to make a difference. And then, after just a few weeks of regular activity, walking, swimming, or even light strength training, they noticed they weren't just feeling better during the day, but during intimate moments too. That's no coincidence. Physical activity improves blood flow, balances the nervous system, and reduces stress. All critical factors in controlling ejaculation. More specifically, I often recommend high-intensity, interval training, or HIIT. You don't need to be an athlete to do it. Even short bursts of effort, 7 to 10 minutes a day, have been shown to significantly reduce symptoms of PE in men. Why? Because this kind of exercise strengthens the connection between the mind and body, building awareness of internal sensations, including the early signs of climax. That awareness is key. Then there's something that most men never think about. The pelvic floor, these are the muscles that support the base of the bladder and genitals, and they play a vital role in sexual function. When you strengthen them, you gain the ability to slow down or even stop ejaculation. Keely exercises, yes, the ones you've probably heard are only for women, can work wonders for men too. I've had patients in their 70s come back after just a month of doing daily Kegels with
stories of deeper control and greater confidence. But perhaps the most transformative techniques I teach aren't physical, they're behavioral. The start-stop method, for example, is one of the oldest yet most effective tools we have. It's exactly what it sounds like. During sex or solo stimulation, when you feel that moment of no return approaching you, pause. You stop everything you breathe, and once the intensity subsides, you begin again. Do this a few times during each session, and over time, you train your body to extend your endurance.
naturally. There's also the squeeze technique, a physical intervention where gentle pressure is applied to the base of the penis just before climax. It interrupts the ejaculatory reflex and gives you just enough space to recover and continue. It may feel awkward at first, but like anything, practice builds skill. Some men find additional benefit from modern tools like masturbation training devices. These devices designed to mimic real intercourse help build control in a safe, low-pressure environment. Think of them as physical therapy for your sex life. Structured, private, and designed to rewire habits that may have formed over time. The beauty of these non-medical approaches is that they do more than delay ejaculation. They reconnect you with your body. They rebuild a sense of control and quiet the noise of anxiety. And in a way, they remind you that sexual intimacy isn't just about performance. It's about presence. Now, for some men, these techniques alone are enough. For others, especially those with deeper biological imbalances, medication can offer added support, and that's what we'll explore next. Because while lifestyle changes are powerful, there are also targeted treatments that can work hand in and to help you achieve lasting change, and some of the options might surprise you. 5 medication-based treatments for premature ejaculation. There comes a time when, despite our best efforts through exercise, breathing techniques, and even retraining our bodies, progress feels limited. That's when many men look at me and say, "Doc, I've tried, I've done everything you've asked, but I still need more help." And in that moment, I see something shift, because what they're really asking is there something
More I can do? Or is this as good as it gets? The answer is yes. There is more we can do, and no, this is not the end of your story. Medication, when used thoughtfully and with guidance, can be an incredibly effective tool in treating premature ejaculation, especially when paired with the behavioral and physical techniques we've already discussed. But the key is knowing what options are out there and understanding how they work with your body, not against it. One of the most common and accessible treatments is the use of topical anesthetics, usually in the form of creams or sprays containing lidocaine or
benzocaine. These are applied directly to the head of the penis and work by dulling the sensitivity just enough to delay ejaculation. For men who feel hypersensitive, where even moderate stimulation leads to early climax, this can be a game changer. The effect is localized, temporary, and doesn't require you to take anything orally. But like any tool, it has its trade-offs. Some men report a slight reduction in pleasure. Others forget to wipe it off before sex, and their partner ends up feeling numb too, but used correctly and consistently. These creams can buy you those extra minutes of control that make all the difference. Then there are antidepressants, specifically a class of medications called SSRIs, or selective serotonin reuptake inhibitors. Drugs like paroxetine, sertraline, and fluoxetine are commonly prescribed not just for mood, but for their well-known side effect: they delay ejaculation. It turns out that serotonin, the brain chemical these drugs boost, also plays a critical role in sexual timing. When serotonin levels rise, so does your ability to control climax. What's important to understand is that these medications don't work instantly. They typically need to be taken daily and can take a few weeks to reach full effectiveness. Some men experience side effects like reduced libido, mild nausea, or fatigue, especially early on, but for many the benefits far outweigh the temporary discomfort. In fact, I've had patients who spent years feeling defeated by PE finally feel like themselves again, after just a month on a well-matched SSRI. There's also a short-acting version of this class called duloxetine. It's taken on demand, meaning only when you anticipate sexual activity, and it starts working within a few hours. Unfortunately, it's not yet approved in the United States, but it is available in other
countries and has been shown to be effective for men who want flexibility without committing to a daily pill. For those dealing with both premature ejaculation and erectile dysfunction, a combination more common than most men realize, medications like sildenafil Viagra or tadalafil Cialis can be especially helpful by improving the quality and duration of your erection. They reduce the urgency to rush sex. This in turn allows your body to relax, stretch the experience, and reclaim some of the control you may have lost. However, these medications aren't a direct fix for PE on their own. They work
best when the root issue also involves difficulty maintaining an erection. It's important to remember that no medication is perfect. Every option comes with its own considerations, and not every option is right for every man. That's why working with a doctor who understands the nuances of sexual health, especially later in life, is so critical. It's not just about writing a prescription, it's about choosing the right strategy for your life, your body, and your goals. What I want you to take from this is hope. Because when you combine medication with intention, when you pair it with effort, understanding, and the willingness to take back your confidence, the results can be profound. But here's the most important part. No matter where you are in your journey, there are small, powerful actions you can take, starting today, that can lead to lasting change. You don't need to wait for a prescription, a perfect moment, or anyone else's permission. The next chapter starts with you, and in the final section, I'll show you exactly how to begin. 6. What you can do today. By now you may be feeling two very different things. Relief that there are answers, and maybe some regret that you didn't learn them sooner. That's normal. I've sat across from so many men who've lived with premature ejaculation for years, thinking it was just something they had to tolerate. Some assumed they were too old to change. Others were afraid to talk about it even with their closest partner. But the truth is, no matter how long this has been part of your story, there are steps you can take right now today that can begin to shift your experience in a real, lasting way. I want to offer you a starting point. Not a prescription, not a miracle cure, just a path. Something you can return to one step at a time with. Confidence. First, start paying attention to your body again. Not in frustration, not in judgment, but with honest curiosity. When during intimacy, do you feel yourself losing control? What triggers that moment where everything feels too fast? Just becoming aware of that shift is a form of training, and awareness leads to choice. Next, start rebuilding from the ground up. Literally, begin doing pelvic floor exercises each day. 10 minutes, no equipment, no one even needs to know. Contract the same muscles you'd use to stop a stream of urine. Hold for a few seconds and release. Do it regularly.
Within a few weeks, you'll likely feel a subtle difference in control, and that subtlety grows.